name given to a collection of related diseases in all types of cancer. Some of the body's cells begin to divide without stopping and spread into surrounding tissues. Do you know 10 million people around the world die each year from cancer? According to a recent report by the National Cancer Registry Program of India, the projected numbers of patients with cancer in India is 13,92,179 for the year 2020. And the common 5 leading sites are breast, lung, mouth, cervix, uteri, and tongue. At MediCircle, we are conducting an exclusive interview series on the occasion of World Cancer Day, showcasing eminent oncologists over a discussion to bring awareness about cancer, its treatments, and myths related to it. In this initiative today, our guest is Dr. Prasenjit Chatterjee. Dr. Prasenjit Chatterjee is a senior clinical oncologist at Apollo Gleneagles Hospital. He is a founder member of Sabujer Abhijan, Children's Wing of Stride, an NGO where economically challenged and cancer survivors perform in tandem with other children in routine cultural and academic events. He has published a handbook on modern radiotherapy in January 2010. He has authored and published several research papers and received the Best Paper Award in the first SAARC conference on clinical oncology held in Dhaka, Bangladesh in March 2001. He is also honored with several awards like the Bharat Jyoti Award on the behalf of IIFS in December 2010 and Rashtra Pratibha Puraskar in the year 2012. So welcome Dr. Prasenjit to MediCircle.
Proud moment to be talking with somebody who is from my academic temple where I have my training done. So it is good that we connect and we exchange some ideas for the benefit of the society. So I'm waiting for that opportunity.
Sure. Thanks, Dr. Prasenjit, for joining us here. What are the most common misconceptions or myths related to cancer?
Yes, if you search the the Google, you can get number of hits on this topic, which has been existing for last 3 to 5 decades. And till there, when we sit in our office and see patients, myths and misconceptions in cancer remain a big issue. So I think this needs to be addressed in our day-to-day setting. And I thought this to be a very important question to be addressed when we explore these issues and discuss for the common man. See, there are a lot many myths and these issues which still exist. Amongst them, the common being, as you know, cancer is a death sentence, or sometimes in common word, people say cancer has no answer. So I strongly defy that and say no, 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 because as you know, you have been discussing about the common cancers which Indian Cancer Registry has projected, and you know, breast, prostate, and thyroid cancers has an excellent 5-year survival of 90%, and all cancers together in the Western literature has survival of 5 years, 60 to 65%. Vis-a-vis in the Indian data, we have around 55%. So there has been downstaging in last 2 decades in a big way because of increased availability of infrastructure as well as increased awareness of the people. So that is very important. So no way we can say that cancer is a death sentence. So it is only the awareness which can definitely work out. There are other myths also. Sometimes not many patients who come back and then keep quiet when we discuss about diagnosing of the disease, like doing a biopsy or a surgery. Now, people always say, majority of the situation, that certainly if we do a biopsy, doctor, is there a chance that the cancer will spread? Again, that's no, because surgical excision, biopsy, or a surgical resection is a procedure which is done by a competent and a skilled oncosurgeon, which is done in a different plane. And if it is done so, there is no possibility of dissemination except in few situations that may be different. But generally, biopsy and surgery doesn't cause spread of cancer. That is a myth which is commonly held in majority of the people, and for that reason, diagnosis is delayed. They do alternative and homeopathic treatment, which makes our life more difficult because they'll end up in advanced stages where there is chance of potential cure is reduced. Yeah, there are other common myths also which has been discussed lot many times. Like patients come and say if we use a deodorant or maybe a hair dyeing agents that cause cancer. There have been enough publications so far as deodorant and antiperspirants being used and which shows has a negative impact so far as incidence of breast cancer is concerned. But why this myth has come out, I just want to explore a bit about it because there was a paper in 2003. It was a retrospective study, but statistically not significant, which showed that antiperspirant and deodorant can cause breast cancer. But thereafter, lot many best papers and level 1 evidence studies has shown that there is no incidence of increased diagnosis of breast cancer with use of these agents. Similarly, in hair dye, normally use of dye doesn't cause any cancer, but a hairdresser who regularly exposed to dye can have incidence of some cancers like a urinary bladder cancer. So that is entirely a different story. So these are the some myths and misconceptions which definitely causes. There are many others. I think for interest of time, we'll restrict and we'll carry on discussion. And you can read my blog. There are these discussions discussed in my website, and I'll be interested more to respond to your questions in my blog.
Sure. So, Dr. Prasenjit, my next question is: does cancer have symptoms, or is it asymptomatic?
Look, all cancers are not asymptomatic. Generally, we say cancers which are visible or palpable. Visible means you can see the cancers, like in the oral cavity or
Yes.
a breast tumor lump. So, those visible or palpable, you can feel the lump, you can see the ulcer. Those are the cancers which can be diagnosed in early stage. But other cancers like lung cancer and ovarian cancer, notedly, these are the cancers which are inside the body. So sometimes it becomes difficult to diagnose because again, we don't have a normal screening procedure or a guideline which is implemented in our health care system because of the population explosion. So patients which come with tumors inside the body, like ovarian cancer or a lung cancer, initially in stage 1, stage 2, they generally don't have any symptoms to begin with. And since we don't do a routine screening like a CT scan or an ultrasound of the abdomen, we sometimes delay in diagnosis, especially if these patients are diagnosed incidentally when they are being looked out for some other problems or symptoms, and incidentally they found out to be a lump in the lung or maybe a cyst in the ovary. So we do a tumor marker and then we realize that maybe this is a suspicion. Then we go ahead with a biopsy for confirmation of diagnosis. So some cancers are symptomatic to begin with, and some cancers still are asymptomatic, especially one which is inside the body.
Okay. But in that case, it might delay the process of diagnosis and also the treatment because it is not showing at all any symptoms to the patient.
Yeah, you know what happened with lung cancer in last 2 decades. In fact, it is just last 3 to 5 years. The National Tuberculosis Guidelines has come in a big way and challenged these patients which had symptoms of cough or chest discomfort or blood in the cough. Tuberculosis being a very communicable and common disease in India, patients who are prescribed anti-tuberculosis treatment for months together without any remission of symptoms. But National Tuberculosis Control Program has challenged it and addressed this issue that no patients today can be given anti-tuberculosis treatment only based on the symptoms of cough or chest discomfort, as I was saying. So one has to be diagnosed with a test called Gene Expert, where you find the tuberculosis is positive, then only. So we have been finding out lung cancer being a very common cancer in India. In fact, the second common cancer in male after the tongue cancer. So the chest physician or a general physician usually advise a chest X-ray, or if not found anything, do an HRCT, the high resolution CT scan, where you can pick up the disease in a relatively earlier stage. So that has definitely helped in overcoming those cases where usually lung cancer was found with fluid in the lung cavity, which is relatively advanced, where not much potential cure could be, offered to a patient. So these are the small steps forward where we can diagnose cancers in an earlier stage, because we need the help of the chest physician, the pulmonologist, who come forward and advise at doing a CT scan or a bronchoscopy if there is no remission of cough maximum period of 4 weeks, that is 1 month. That is the guidelines. So that is the way forward where we can pick up more cancers. There are a number of tumor markers which have been also identified, like prostate cancer. A lot of elderly male population in our, life expectancy has increased in India by 10 years in last 1 decade. It was 55 years when the life expectancy when we were medical students, and today it is 69 years. So it is 14 years leap in last 15 years of our practice. So that is a big way. Definitely India is on the right direction. So having said that, we have having more number of geriatric or elderly population who are surviving now. Now, these patients who are above 60 years, they have urinary problems, the urinary incontinence, which was essentially diagnosed by a urologist or a general physician as benign enlargement of prostate. Prostate grows with time, unlike other organs, which usually atrophies with age. Prostate is a structure which is in the pelvis in the male population. It grows and it can cause urinary obstruction, or there is a blood in the urine. So these are the patients who are empirically diagnosed as benign enlargement. That is a benign enlargement without any cancer change. But more number of such patients, we now do a simple blood test called PSA, prostate specific antigen, which if given by a number of units, which is more than normal, we suspect that he can have a disease like cancer of the prostate instead of a benign enlargement. Similarly, for some other cancers like ovarian cancer, we do a tumor marker, simple blood test like CA125, which if raised remarkably can also give an judgment that this patient can have an ovarian cancer. So you need to evaluate and work up these patients to pick up the disease in an earlier stage. Hence, that is the way forward. We can pick up more diseases in an earlier stage.
That's very great to know, Dr. Chatterjee. Uh, like we have got different figures about, I mean, the way the disease is big. Like with the passing years, there has been an increase in the number of cancer cases. According to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. So, what are the reasons and how can they be controlled? Because we are seeing an increase in the number of cancer cases every year.
Onset, I should congratulate you because you have updated with the Globocon data, because that's a very recent data, 2020, because most of our interactions we are being discussing about the Globocon 2080, the previous data. This is the very current data. We don't have a detailed statistical data on this. This is just recently published. And as you say, it is 1.3 or 13 lakhs incidents, which is dramatically increasing surge. Now, this is going to happen, bound to happen, this increasing surge. Certainly, having said that, this issue needs to be cropped, but it has to be done in a more justified way. You know, there's been this recent article published by the Queen's Group London, which say that screening of all breast and ovarian cancer can be done in female population, will help in picking up by doing a genetic manipulations, a genetic study, BRCA1 and BRCA2. These are the two BRCA tests which is commonly done. And this has in fact become, very common after this. Angelina Jolie, she was a Hollywood actress, and she is an UN ambassador. She had those BRCA1, BRCA2 positive with high family history. Now, if it has been seen by this study group, this is an international study done by the Queen's Group, and it showed that if they do a screening for this genetic testing, BRCA1 and BRCA2, the entire population could pick up disease for millions of people in an early stage in breast and ovarian cancer setting. Now, after that, it has been further evaluated. We did, the subset analysis was done for this particular study, and it has been seen that in high income group and middle income group population, the high income group is the Western developed countries, middle income group is like countries China and Brazil. This was done that if this genetic testing could be done for the entire high risk population, then this can be picked up in an earlier stage. And this has a socio-economic implication as well, because if it is picked up early, then probably that will be more cost effective. But further analysis showed there'll be a societal as well as there'll be a payable benefit so far as the cost saving and cost effectiveness is concerned, only in the higher income and in the middle income countries. But India still is in the lower income group population. So for Indian setting, it is not population, though these cancers are of increasing surge, but we have to work out in a different way. Like head and neck cancer is a common problem in our country. The Indian data has shown that 27% of the population of head and neck cancer is because of tobacco abuse. Now, it has been worked out further that if we can find out a method like an oral inspection or a screening method where we can pick up the disease early, then we can diagnose more cancer patients at an early stage. Again, we are working out in the economics, macro as well as the microeconomics. Now, you can say if more number of cancer patients are diagnosed, then that may not be cost effective also. But this can be again challenged because there are some patients who can be diagnosed in early stage, especially in subclinical stages, if some screening mechanism could be implemented for the society at large. But there will be more number of patients who will not present in their lifetime have a pre-malignant conditions. So that can be, curtailed also. So that should not be an economical challenge for the country. In that perspective, there has been a greater initiative both by the IARC, that is the International Atomic Agency for Cancer, to take a global initiative of diagnostic cancers in early stage. And developed countries has done this good homework. They have been able to diagnose, do genetic testing in the population, which is being proved with a grade 1 evidence, level 1 evidence, that it is meaningful for the society. In Indian setting, a cancer registry needs to be formed. We have one cancer registry, but the level of data, the quality of data is what is most important. There's been evaluated by the WHO. In fact, the WHO has taken an initiative and it has formed that they have formed a hub under the observationship of IARC, that is the International Agency of Cancer Research, that they'll put a hub in the developing countries like Asia, South Africa, Caribbean, Pacific Islands. Of course, these are the way forward where we can pick up a particular risk group of population which is higher in that geographical location. So all cancers which are common in the western part may not be common in India. In fact, India being a unity in diversity, heterogeneous country, cancer which is common in the northeast part of India is not common in maybe south of India. So that heterogeneous population has a bearing so far as incidence of different cancers is concerned. So it has to be worked out, and WHO has taken this initiative very seriously. And in 2020, this subsidiary body has been formed, and I think by 2020 we can make a solution to that. So it's just a matter of by 2030 this can be streamlined and we can have more data on that which will be robust enough to give us a solution. How can be the way forward to diagnose which cancers can be prevented or picked up at an early stage, to offer them treatment and just improve the cancer control, which is a cause of concern today for all of us.
Surely. I think early diagnosis is the key here, because a lot of time these cancers get undiagnosed, and when they are actually approaching doctors, they are advanced stage cancers, and it is really difficult for them also to treat them. So thank you so much, Dr. Prasenjit, for joining us at this World Cancer Day series here at MediCircle. We really thank you from the bottom of our hearts, because you spent your important time, because you are also seeing lot of patients, because once this COVID is receding, lot of patients are actually visiting hospitals, and you being a senior clinical oncologist might be very much busy with your patients, but still you took time and shared this vital information about this deadliest disease, and also this how these symptoms can be tracked. And there are lot of myths, like I think one of the myth which you just discussed, that dyes are like one of the reasons for cancer. I think I have heard this so many times, that even there's a misconception that using dyes or deodorants may lead to cancer. So it was really great, Dr. Prasenjit, for you to join us here, and thank you so much for your time.